comes down underneath the plantar surface of the foot. We know it goes underneath the plantar surface of the great toe and is going to hook in down here at the distal phalanx. So we know where it travels, so I want you to put it into action. So flex down and then give resistance, and then it's going to travel through here like that. Now, if we get that tibialis anterior, when we were examining the ankle, you're going to pull foot back. We said that we would use this tibialis anterior and the extensor. We're going to split those. We're going to push dorsally, not posteriorly, to find the navicular bone. So tibialis anterior. Tibialis posterior is going to just foot here and invert and resist. We know that it's going to pass underneath our, or in the back side of our medial malleolus, come around and insert here. Some people, you'll be able to see that tendon. The peroneus brevis, push out, and we're going to follow that down to the base of the fifth. Okay? Now, we've gotten, I think we've talked about that before. I think all of us know plantar fascia. If we come off the calcaneal tubercle, bang, we're right there on that. The Achilles tendon as it hooks into our calcaneus, and then we follow it back up. Our retrocalcaneal bursa sitting right in there. That's where we get a lot of issues and problems. That gets inflamed, and then obviously our tendon there. We know how to find the dorsal pedal or dorsalis pedis artery. We extend great toe, and then we palpate on the dorsal aspect of the foot. Where we really kind of left off was we were talking about anterior talofib, posterior talofib, oh, and the tibialis posterior artery too. But we're going to find these lateral ligaments. That's what we're coming in on now. My lateral malleolus, the syndosmotic joint. Remember, I told you it's not as high. This is the syndosmotic joint going all the way up. So if we were to picture our tibia here and our fibula here, right there sits our syndosmotic joint. So anterior talofib, tibiofib, and posterior tibiofib. So yesterday in class, in lecture, we talked about this. Right here is my sinus tarsi. So go ahead and get into a neutral position like so. We're not going to put her back into dorsiflexion. We're going to put her in neutral position here. Right in here is going to be my sinus tarsi. Okay, right in that area. Now my ATFL is going to live right in this area as well. Okay, so it's going to be living right in there. So right there, sinus tarsi, anterior talofib. Okay, then my calcaneofibular is coming straight down here, and then my posterior talofib is sitting right back here. Now, in real life, there's a capsule that all goes down through here. Okay, and these ligaments are not, you know, necessarily that kind of isolated. There's other connective tissue that you have in there. But this is the ligament that we talk about the most with plantar flexion and an inversion ankle sprain. That's the first one that goes. And then we have our calcaneofibular ligament sitting right there, posterior talofib. Our syndosmotic anterior tibiofibular ligament sits right here. And then that syndosmotic membrane going up. Same thing back here posteriorly. So our finger placement is right here. Okay? And then our lateral malleolus, if I come along that posterior edge, then if I go to the medial side, my whole medial side, we've got these four ligaments here, right? And we just collectively call those the deltoid ligament. So that's my deltoid ligament sitting right there. And so you move that around, you can be right in that joint space right there. Then the posterior edge of my medial malleolus, which is basically my posterior or my distal tibia, and this is my distal fibula, right? Okay. Now, can somebody scroll down for me? We're going to palpate. Oh, never mind. I got it right here. Right there. We've already found the calcaneonavicular ligament. I told you guys to find that with my IP. I'm going to be on the sustentaculum tali. I've got my navicular bone sitting right there, and then I'm going to have a little space in between those two. So sitting right in there is going to be my spring ligament, is going to be sitting right here. Right there. So find that. If you found the sustentaculum tali right there, I find my navicular bone, you're going to drop off into that little spot right there, and that's going to be the spring ligament, calcaneonavicular ligament. Okay? Anybody have any questions on those? We're going to review those here in just a second. We're going to go through them all. I want to do the motions real quick, and the things that you're going to look to do in lab. We'll show the whole class here. So what you'll do in your on the exam is I want you measuring. Somebody's going to have extension and measure that. We're looking for 70 degrees. Book tells us 75 to 85. Dorsiflexion, we're going to measure that, and I'll show you guys how to measure that. So when we're doing a real-time exam, let's say for the foot, we just want to see, can you pull toe down, toes? Can you make your toes down, squeeze them down and extend them? Okay, so we want to see, can they do that, right? And then we'll come in there and we do the MMT, extensor hallucis and then flexor hallucis, boom. Now when it comes to the ankle, I just need 3 motions. I want to see, can you pull your foot all the way back? Okay, can you push it all the way down? Can you turn it in? There's 4. And can you turn it out? Okay, so that's our active range of motion. Then when we come in there to MMT, we're going to do tibialis anterior, right? Turn foot in, don't let me break. Tibialis posterior, turn foot out. Peroneus brevis, or peroneal group. Okay, looking at the dynamic stabilizers of the ankle. When I do my passive range of motion, we did the great toe. Remember, that was a test for us in the fact that we just want to see, do they have pain in full extension? Okay, there's other things like hallux rigidus. We might not be able to get them into flexion. We might, actually hallux rigidus prevents this extension, but they might have pain in flexion, right? So if they have hallux rigidus, there's a spur sitting right there and we can't get them back there. But one of the main reasons we do this is for that plantar plate. Passive range of motion for our foot, we want to see, do you have pain up in dorsiflexion, end range? Do you have pain in plantar flexion, which we're anticipating that they will, right? Anytime that we have a lateral ankle sprain, even a medial ankle sprain, they're probably going to have pain here. They're going to have pain when we push them into inversion, pain when we push them into eversion. Possibly they'll have some pain with that, but we're looking for end range pain. That's what we'll do with that. Now, some of the tests that we've already done the toe stuff all the way down, long bone compression and Tennell's. We did the Tennell's right back here. So how do we do the anterior drawer? What I want to do first is do our measurements, and then we're going to come back and we're going to look at some of these specific tests because we haven't covered those necessarily in the lecture either. So we're going to measure the toe, then we're going to break off into the groups. I'm going to take you through finding each one of these spots, then we're going to get back to our lecture. Beverly, you have enough room you can scoot back there without falling off? Yep. So when we measure great toe, when we measure extension, our fulcrum is going to be the joint line. And it's going to vary for each one of us, right? Whenever we get in here and we figure out where that is, where that joint line is. So our fulcrum is going to go on that. Our first ray is going to be the stationary arm. So we want to get it on that first ray, bend them back, and then try to get them to stay in extension. And we're going to use our phalange as our movement arm. Oh man,
there you go.
She get almost to 90 degrees. Wow. That's crazy.
Go Bev.
She has no issues with great toe extension. So that's how I want to see you come in and measure it. Using these larger goniometers is not going to be very good, but I'll have this one there for you. A smaller one works. So first ray is going to be our stationary arm. We're going to find the joint line, and that's going to be our fulcrum. So I'm stabilizing along the first ray, our fulcrum in the joint line. Take your great toe and push it back, and then you want to move your movement arm is going to go along the phalange just like that, and then you're going to take your measurement. I'm just at 75 degrees there, so she can go all the way back to 90 degrees. Okay, so that's how I want you guys measuring, and you can practice with that. Dorsiflexion, we're going to measure from the lateral side. Okay, so we're going to use our lateral malleolus but we're going to drop it down to the 5th ray, okay? So what I'm going to do is I'm going to push her back like this. I find it, and then I'm going to push it down to here. And so I'm going to use that as my stationary arm, and my fulcrum really drops down just kind of in line with my 5th ray and in line with my lateral malleolus, and then I can use my 5th ray as my movement, okay? So she's only moving back about, so she's right there, she's at neutral, that's on neutral right there. She's at 5, she's at 10 degrees dorsiflexion. You see that? And that movement from there to there, okay? So that's about 10 degrees. That's how I want you to measure dorsiflexion. So we come in here, just place your hand up here like this on their shin. You're going from that lateral malleolus, just drop it straight down, grab a hold. You got your movement arm on here, take them here, and you push them back, and you're measuring there. So you take them from 0. I can probably get 15 degrees almost, okay? So that's how I want you measuring dorsiflexion. We never want to lose great toe extension, and we never want to lose dorsiflexion for what it is on them, okay? All right, so here's what we're going to do. Let's break up into your groups, and I'm just going to read off like I do.